4 common medications that can damage your kidneys. In today's world, medications are both beneficial and harmful. While they can be beneficial, medications also pose risks, especially to our kidneys as we age. As our kidneys naturally become less efficient over time, it's essential to avoid overloading them with chemicals and medications. Unfortunately, aging often brings more health issues and more medications. Certain drugs can cause kidney damage, known as nephrotoxicity. This damage can impair the kidney's ability to filter blood, leading to serious health problems. Kidney damage can range from mild to severe, with the risk increasing with age and pre-existing kidney conditions. There are 2 main types of medication-related kidney damage: dose-dependent and idiosyncratic. Dose-dependent toxicity means that the damage worsens with higher doses of the drug. Idiosyncratic toxicity is unpredictable and differs from person to person. Sometimes the safest approach is to avoid these drugs altogether. Drug-induced nephrotoxicity can result from muscle breakdown, rhabdomyolysis, kidney tissue death, renal infarction, and acid buildup, renal tubular acidosis. These issues can lead to reduced kidney function, nephrotic syndrome, or electrolyte imbalances. In this video, we'll discuss the impact of common medications on kidney health. Understanding these risks can help you make informed healthcare decisions. Stay tuned to learn how to protect your kidneys while managing other health conditions. Before we begin, please note that all information in this video is human-produced, thoroughly fact-checked, and reviewed by professionals. Let's examine the medications that can harm your kidneys. 1. Antibiotics. Antibiotics are frequently prescribed, but they carry risks, particularly for your kidneys. If your doctor prescribes antibiotics for a sore throat, skin infection, or other infections, they could potentially harm your kidneys. To begin, let's clarify what antibiotics are. Known as antibacterials or antimicrobials, these drugs combat bacterial infections by either killing the bacteria or inhibiting their growth. They are used to treat bacterial infections like strep throat, pneumonia, urinary tract infections, and skin infections. However, antibiotics are ineffective against viral infections such as colds, flu, bronchitis, most coughs, and most sore throats. Thus, it's important to be cautious when your doctor prescribes antibiotics. Misusing antibiotics can cause side effects, including diarrhea, as well as liver and kidney issues. Certain antibiotics such as polymyxins, aminoglycosides, and vancomycin have the potential to cause harm to your kidneys. While your kidneys are crucial for eliminating antibiotics and medications from your system, certain antibiotics like polymyxins can harm kidney cell membranes, resulting in injury. Likewise, aminoglycosides can accumulate in kidney cells, leading to cell death and harming kidney tubules. Although the precise mechanisms by which each antibiotic causes kidney damage aren't fully understood, it typically involves inflammation and damage to kidney cells. To ensure antibiotics are effective and safe for your kidneys, it's crucial to use them correctly. Did you know that nearly 1/3 of antibiotics prescribed in the US are not suitable for the conditions being treated? This information comes from the Centers for Disease Control and Prevention, CDC, and a study published in the Journal of the American Medical Association. Before requesting antibiotics or accepting a prescription, it's important to understand which conditions they are meant to treat. Ask your doctor if the antibiotic is necessary. Most doctors will be happy to explain the reason for the prescription. If antibiotics are truly needed, make sure to follow the dosage instructions precisely and adhere to any dietary guidelines. Even if you start to feel better, never save antibiotics for future use or share them with others, as prescriptions are specifically tailored to individual health needs and conditions. Are you enjoying our video so far? If so, please let us know by liking it, and we'll create more content like this. 2. Non-steroidal anti-inflammatory drugs. Many people might not be familiar with the term non-steroidal anti-inflammatory drugs, NSAIDs, by name, but you've likely heard of ibuprofen or aspirin. These are all NSAIDs, and some are available over the counter. In fact, more than 30 million people take NSAIDs every day. NSAIDs are commonly used to relieve headaches, sprains, colds, flu, and arthritis pain. They work by blocking an enzyme called cyclooxygenase, HeQX, which is involved in producing substances that cause pain. However, QX also plays a role in protecting the kidneys during stress and regulating sodium and water excretion. By inhibiting QX, NSAIDs can potentially harm your kidneys. All NSAIDs can lead to acute kidney injury, particularly in older individuals and when used in high doses or overextended periods. This injury occurs in two main ways due to the blocking of QX. First, blocking QX can narrow the blood vessels in the kidneys, reducing blood flow. This reduction can lead to fluid retention, high blood pressure, and temporary kidney impairment. If not managed, it may result in severe problems like acute tubular necrosis, which can lead to acute kidney failure. Although it might initially present as acute kidney failure, it can progress to chronic kidney disease. Second, despite their anti-inflammatory properties, prolonged use of NSAIDs can induce inflammation in the kidney tubules, which are responsible for filtering waste. Although inflammation from NSAIDs is rare, kidney issues related to their use are a significant concern, affecting 1% to 5% of daily users worldwide. This translates to approximately 500,000 to 2.5 million people experiencing kidney damage from NSAIDs each year. Moreover, NSAIDs are frequently linked to hospital admissions due to adverse drug events, some of which can be fatal. A 2006 study published in the Journal of the American Society of Nephrology examined data from over 10,184 individuals prescribed NSAIDs and found that NSAID use increased kidney risk, particularly within the first 30 days of use, underscoring the need for caution. Another study investigated 99 patients with chronic musculoskeletal pain who took NSAIDs for 12 months. After the use of NSAIDs, most patients experienced a decline in kidney function, which later recovered upon switching to a different pain reliever. For those seeking evidence, the studies backing our statements can be found in the link provided in our description. The upcoming drugs on our list may come as a surprise, as they are usually known to be beneficial for kidney health. 3. Diuretics. Diuretics are used to manage conditions like fluid retention or swelling, which are common in heart and kidney failure and liver cirrhosis. While some diuretics are available over the counter, prescription diuretics like spironolactone and acetazolamide are usually more potent. These medications work by increasing urine output and removing excess salt and water, which can help lower high blood pressure, a significant risk factor for kidney disease. Generally, diuretics are considered beneficial for kidney health. However, despite their advantages, they carry risks, particularly concerning kidney function. Although diuretics don't directly damage the kidneys like NSAIDs, they can alter the concentration and composition of urine by increasing its volume and modifying electrolyte levels. Excessive use or high doses of diuretics can result in dehydration, a risk factor for kidney damage. A study involving 131 patients who experienced acute kidney injury between 1999 and 2010 at a hospital revealed that 96.2% of these patients already had at least one pre-existing health condition before starting diuretics, with chronic kidney disease, CKD, being the most common, affecting 55%. The study also found that patients using diuretics had higher rates of kidney disease and associated risk factors such as hypertension and diabetes. The risk of kidney damage increases with the dose of diuretics. Approximately 27.5% of acute kidney injury cases were attributed solely to diuretics, while others were caused by a combination of diuretics and other medications. It's crucial to consult your doctor before starting any new medications alongside diuretics. For individuals with chronic kidney disease, CKD, who are taking diuretics, maintaining proper hydration, and regularly monitoring electrolytes and kidney function is essential. Nowadays, home testing options are more accessible, allowing you to monitor your kidney function from home. 4. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are commonly used medications available over the counter that effectively treat conditions such as gastroesophageal reflux disease, GERD, or acid reflux by reducing stomach acid production. They work by targeting an enzyme in the stomach called hydrogen ATPase, or proton pump, which is essential for acid secretion. While PPIs are generally safe and effective in relieving acid-related discomfort like heartburn, they do come with potential risks. They carry risks particularly for kidney health. PPIs have been associated with acute interstitial nephritis, AIN, a kidney disorder marked by inflammation in the spaces between the kidney tubules. While only a small percentage of PPI users develop AIN, these medications have become a common cause of drug-induced AIN in developed countries. AIN caused by PPIs often lacks clear symptoms and can easily go unnoticed. Long-term use of PPIs can result in decreased kidney function and sudden acute kidney injury, which may advance to chronic kidney disease, CKD. Additionally, prolonged use of PPIs can lead to low magnesium levels in the blood, known as hypomagnesemia, which is associated with CKD. Hypomagnesemia can disrupt electrolyte balance and cause inflammation, contributing to the development of kidney disease. It can also lead to other serious health issues, such as muscle spasms, seizures, and irregular heartbeats. A 2019 study published in the Journal of Pharmacotherapy investigated the impact of PPIs on kidney function. The study explored the relationship between PPI use and new cases of acute kidney injury, chronic kidney disease, and other related conditions in a large population. The findings revealed that among 93,335 participants, those using PPIs had a 4.35 times higher risk of acute kidney injury compared to those who did not use these medications. Similarly, among 4,600 people, those using PPIs had a 1.2 times higher risk of chronic kidney disease, CKD, compared to non-users. Consequently, individuals taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. While PPIs can offer substantial relief from acid-related conditions, long-term use can negatively impact kidney health and lead to other issues, such as infections, fractures, or nutritional deficiencies. It is crucial to use PPIs for the shortest duration necessary to manage acid-related problems, minimizing the risk of potential side effects. If you find this information beneficial, remember to like, subscribe, and share for additional knowledge on healing through nutrition. Thank you for watching this video. Stay safe until we meet again. Goodbye.